Welcome to McPlum, simple solutions served daily.
You begin with clean hands and sterile parts, do not delay. First, assemble the lower vent and straw, make sure the O-ring sits flat and clips click. Attach the nipple and collar loosely so air can escape when you prime the system. Pour warmed formula or breast milk, then press the vent to expel trapped air. You'll feel a brief resistance. Once done, tighten the collar fully and check that the nipple hole aligns correctly. This controls flow and reduces gulping. Now you focus on flow. Prime the vent by holding the bottle upright and pressing the anti-colic system so 1 or 2 small air bubbles release. This seats the vent. Next, invert and gently squeeze to confirm a steady, slow drip. If it gushes, swap to a slower nipple size. Make sure the nipple hole faces upward so milk, not air, reaches the baby. Once satisfied, secure the cap, recheck temperature, and position yourself for a calm feed. During feeding, you hold baby semi-upright and watch swallowing. Pause every 3 to 5 minutes for a quick burp to release any trapped air. After the feed, disassemble all parts. Rinse immediately, then scrub the vent straw and O-ring with the provided brush to remove milk residue. If you notice leaking, gurgling, or poor suction, stop and reseat the O-ring and vent. Misalignment causes most issues. Replace any cracked or stretched parts. Once fixed, reassemble.
Thanks for watching. Stay juicy and subscribe.